Hi, everyone, and welcome to Basic Black. Some of you are joining us on our broadcast, and others of you are joining us on our digital platforms. I'm Crystal Haynes, your host for this evening. Callie Crossley has the night off. Tonight, children of color living with ASD. A recent report from the CDC saw a rise in the number of children of color being diagnosed with autism spectrum disorder, or ASD. Reasons for this increase vary, from the pandemic to more awareness and decreased stigma in communities of color. But while this may be good news, historically, children of color, in particular Black children, have been diagnosed at later ages than white children, delaying their development. And for parents and families of color with children with ASD, seeking resources and finding answers can be an enormous challenge. Joining us this evening to discuss is Dr. Karen Spencer, an assistant in the Department of Neurology at Boston Children's Hospital. Cynthia Laine is the founder of the Black Autism Coalition and a mother of 2 kids with ASD. Jay Wilson is a doctoral student in clinical psychology at Boston University Center for Autism Research Excellence, or CARE. And Joy James is a developmental specialist at the Dimock Center in Roxbury. Welcome to you all.
Thank you for having us.
Well, I want to start with the CDC data. And I'll start with you, Dr. Spencer. I mean, what did you make of what this is being sort of described as new information, which I'm sure is not new to anyone here on this panel?
Sure. So basically the CDC report, as many know, it shows a 30% increase in the number of children with autism, children of color who are diagnosed. It's important to know that these children, these are looking at 8-year-old children, so we're looking at about a couple years beforehand of people being diagnosed with autism, seeing this increase. I think for most of us, we see this as a very good thing that this increase has happened. This reflects likely an increased awareness about autism in general, increased access to clinicians who diagnose children with autism, as well as kind of closing some of those disparities in terms of how late children of color, particularly Black children, are diagnosed compared to white children in general. So I think there's a lot of factors that kind of play into it. There's also been a lot of education for early intervention specialists in terms of educating parents at the point of concerns about their development. There's been some increased awareness around pediatricians referring earlier to specialists who diagnose, who specialize in diagnosing children with autism. So all those factors together, as well as, not to mention the public health, education and things like that that's gone on, and awareness campaigns. So I think those factors together has led to a significant increase, which I think is a true success story in terms of being able to identify and treat children earlier.
And Jay, you know, in your work, were you surprised by this data that came out?
I was not surprised by the data. I've definitely heard a lot of anecdotes of participants who've been involved in our research talking about just getting earlier diagnoses and talking more with friends and family and getting better feedback from them. I do think that there's another frontier with research, and I think Black and brown communities have a reason to distrust sometimes research facilities. We all know about the Black men's syphilis study and other abuses that have happened between these communities. On the other side of that, that means that a lot of Black and brown children aren't involved in the research that's telling us about why there are different language outcomes for people with autism. That's telling us about genetic differences, neurological differences. And I think there needs to be this positive feedback loop where we're establishing trust with these communities, and then we're getting the data and the feedback back to these communities so that we're actually serving them and helping them to understand their children.
Yeah, Cynthia and Joy, of course, you know, when you hear there's a rise, are you seeing a rise in the number of families that you're touching?
I do, and the good thing is now is the education point, because a lot of family are educated by other advocates that's out there, like myself, letting this community knows it's okay, and they are taking the step of getting their children diagnosed, which is a very important thing. And you have people like myself saying like, hey, I do have 2 children with autism. It's okay, and it's not the end of the road. It's just getting the child what they need, the resources that they need, so they can continue to live the life that we once wanted them to. Because a lot of the time families, once they get the diagnosis, they think life is over for them. And that's why they don't want to. They They don't want nobody around them to know. But like, as parents, as myself, we're coming out, we say, hey, listen, my son can be a great basketball player, you know, if I continue to get him the help that he needs. So it's definitely a lot of the rises with the families that I work with. I work with a lot of the Black and brown, and also a lot of the Haitians, because I'm from Haiti myself. And culturally, anybody with a disability, it's like a disadvantage for the community. They want to put you aside, but you know, just families coming now, it's like, hey, it's enough. Like, let's take care of our children. Let's get these services the way that we're supposed to.
Joy, I saw you sort of emphatically agree with what Jay was saying.
Yeah, I definitely think that because Roxbury is majority Black, Hispanic, and Latinx, we're having hands-on experiences with families who are getting these diagnoses. And as an early intervention specialist, it's kind of us helping educate families about what the signs of autism are, and then directing them to the appropriate assessments to receive the diagnoses. So we're definitely seeing a rise because we're having hands-on experiences.
And, you know, to follow up with that, we know that stigma, especially in Black and brown communities, for anyone with a disability, can be a barrier to treatment, can be a barrier to diagnoses, and there can be shame that comes with that. Talk to me about how that sort of jives with this data we're seeing out of the CDC. We're seeing that people are more willing to report it, according to the federal report here, but there has to be more folks that are not reporting it, right?
Yeah, well, I think Jay said something that was incredible with establishing relationships. And as an EI clinician, I'm working hands-on with the kids and their families to establish relationships and build trust in order to let them know I'm validating your fears and the stigmas that are around autism, but also letting you know that a diagnosis can open so many doors that will only strengthen your child. And early intervention is a strength-based program. And you just mentioned that your son is an amazing basketball player, and he's more than his diagnosis. And we need to empower families to know that and feel that.
And Cynthia, I want you to talk more about this stigma piece. In fact, I'm going to ask you all about this, but talk more about this stigma piece. I know that there are so few actual support groups for families of color dealing or living with kids who have ASD, dealing with trying to get treatments and services and a diagnosis to begin with. So talk to me about how you talk families through, walk them through this stigma piece.
Yes, it all started for me back with 2020 when the pandemic started. So a lot of families did not know where to go, and you have the kids that were in the household and they didn't even know how to interact with their kids. And we started a support group over Zoom, and that's how it all started for us. And families were just coming in, and then we were just sharing our children. People were coming in and saying like, well, my son broke my my iPad, and we were like, one iPad? We're into like 3 or 2 or 4, and we used to laugh with each other. And there were mothers that were coming in with tears in their eyes because of what was going in the home, but we had that time where we were communicating with each other. And one thing that had happened during the pandemic, that's why I'm saying support group is very necessary, and there's not that many in there. The fathers, because of the fact that when we all into the room, they don't really interact with each other. But when we put them in different Zoom rooms, they were interacting with each other and telling each other what they were feeling and, what was going on when they had the child diagnosed with the autism, things that they did not share with us, because I used to sneak in there hearing my husband sometimes. But it's just showing how important support groups are, but not that there are many out there. It's mothers or fathers that's taking the initiative, the ones that have a child on the spectrum, doing this kind of support group to make sure they can understand. Because one thing I want everybody to know, when you get a diagnosis, yes, I know it's about the child, but everybody forgot about the parent. We don't get that support, whereas when we talk about mental health, this is a child where we had all the great dreams about, and then someone is coming to us and saying that your child won't be able to do this, your child won't be able to do that anymore. No one thinks about how hurtful it is for that parent, because a lot of the children, sometimes they are young in age, they don't understand that effect, but the parents, and that's where the support group needs to be around these parents, where they can say, okay, the doctor gives the diagnosis, here, I can send you to this support group, and then you're going to find parents like yourself. A lot of these parents, they don't get that. They get the diagnosis and then find your way, find these services, and they don't know where to go. And that's why a lot of the time they tend to hide from the diagnosis. So support group is very important, and I encourage, like myself, when I have the parents and I say, hey, I'm giving you guys the resources, I'm doing all this, but I'm not here to do everything for you. I want you guys to go out there and empower others just like yourself. Not everybody can do it, but I want others that want to step up to have the ability to step up to help others as well.
Speaking on that point, you know, I think awareness and giving kids language, even adults language in spaces that kids with ASD have, and that allows them to have an extra support, right? And so I want to show you this clip from PBS Kids program, Daniel Tiger's Neighborhood. Daniel meets his new friend Max and his teacher Harriet's, he's actually his teacher Harriet's autistic nephew. So we want you to take a look at this.
Hi, Max. Can I play with you? I know. We can build something tall. A castle. Max, do you want to help me build a castle? Do you want to play with me, Max? Why isn't Max answering me?
Well, Daniel, sometimes he needs more time to understand the question and decide how to answer. Let's give him some time.
I like buses. I like city buses and school buses and double-decker buses. Oh, I like playing buses too. But I'm not playing buses now. I'm building a castle. My castle is right there. I made a pointy roof, see? Double-decker bus. I want to sit on the top. Why does Max keep talking about buses? I want him to play castle with me.
Sometimes when Max is really excited about something, he only wants to talk about that one thing.
And we know that clips like that allow kids, even at that young age, you know, kids who are watching Daniel Tiger's Neighborhood are 2 and 3 and 4 and so on. It gives them language. Jay, I know that you work with these little ones as part of your work there. Talk to me about having resources like that in the world. It helps in your work.
Yeah, absolutely. We actually have an active study right now called Predicting and Optimizing Language Outcomes, and we're recruiting kids who are between 3.5 years old and 6 years and 11 months. My current work is looking at brain activation when you show kids storybooks that have references to their specific interests. So the example here is double-decker buses. What is happening in their language network when you actually engage them? That's one of my one of my fields of interest. A lot of people consider that a symptom of autism, but I actually think it's one way that really benefits people with autism. A lot of people with autism have specific interests in art and in mathematics, and they go really far with those interests. Those are the same kind of skills you need to do a PhD like I'm doing. You need to be very, very focused. I think there are just so many associations between the way people view autism and the way that people view other marginalized identities, like being Black or being queer. And they have the same interactions with systems of power. So we know that people with autism are differentially policed. Too many of them end up in jail or killed by police because they don't know what's going on. And so I think that there are really a lot of points of contact between Black and brown identities and people with autism to offer them understanding. The disability that they have, they're disabled by the world because we don't set up the right accommodations and services for them. The disability doesn't really exist within themselves. They have differences that matter and that count. And when you leverage those differences and you see them as a part of your communities, they can go really far.
Absolutely. You know, Dr. Spencer, as we were doing research for this show, I saw that there was a study out of McGill University that shows that there are physicians that are hesitant to actually diagnose ASD in Black families, and we know that getting a diagnosis can be a challenge. What do you think needs to change in the healthcare space in order for physicians to give families the diagnosis so then they can get that treatment that they need?
I think that's a great question. I would definitely be interested in kind of knowing more about that study, but in general, I think that we know that there's such significant healthcare disparities for black people and black families in general, you know, and so I think there needs to be a lot of recognition from providers about what they can do personally to make sure that they're giving the same care to everybody regardless of their race, or not even regardless, considering their, making sure that they consider strongly, you know, their race, and making sure that they're, you know, what the treatment they're giving and the care they're giving does not differ between, you know, different families. I think that I have heard, you know, I think kind of anecdotally, you kind of have people who get nervous when people have what they consider stronger reactions to things and things like that, which might make them more hesitant. However, that makes them, you know, but their reactions shouldn't really affect what kind of care you give and how you deliver the news. It just means that, you know, you can acknowledge it, you know, acknowledge that, oh, I see you're having a strong reaction right now. You know, what's, you know, how can I help? Or, you know, just acknowledge the elephant in the room if you're feeling that, you know, and I think that comfort is something that a lot of physicians need to learn in order to kind of give people the care they deserve.
When you were seeking your diagnoses, or when your sons were diagnosed, I don't know if you sought one out or if it was something that was sort of brought to you, Cynthia, you know, was it a difficult process? Was it something you sort of noticed that your kids needed, or?
When it comes, I have my two first children, they have ASD. So my second child, who was diagnosed before my first child. So my oldest got diagnosed at 5 years old. And the reason of that is because I did see the signs. He was walking on his tiptoes, for example. But when I brought it to the provider, it was like, oh, he's a boy, he'll get over it pretty soon, don't worry about that. So that's why early intervention is important. But they did refer me to early intervention, not knowing what it was, but I did enroll my son, my oldest, and ended up enrolling my second child in there. So as he was enrolled in early intervention, and that's when the person working with him had realized that there were some signs of ASD. So she said, hey, I see some sign of autism. And I said, what is autism? Because I had no idea what it was. And to make a long story short, you know, she said, bring it to the pediatrician, which she gave me a referral and asked me to call to get a diagnosis. It was supposed to be at Boston Children. And they told me the waiting time was 5 years. Wow. And at that time, my son was 18 months. So I could not wait, and I went back, and he said, hey, you know what, call different places. And that same young lady, I'll never forget her, because she's the one that has a lot to do with where we are today. She had said, hey, listen, I'm gonna check with a friend of mine that works for this agency. And then that's how we ended up getting the diagnosis. And I was referred to another center for my son, and that doctor over there, because I was with my oldest at that time, realized like, hey, we're seeing some signage here. It'll be good that we do get a diagnosis for your son, do an evaluation and stuff. And that's how I ended up knowing at 5 years old, my son was diagnosed with ASD, and my youngest at 18 months. So imagine the gap that was this whole time he's been in school.
The 5 years.
Yes, and yes, the 5 years, that's another thing. And imagine too, waiting the 5 years plus my other son that was already at 5 at that time, that's 10 years. So he would have get diagnosed at 10 years old. So that's why it's very important that, you know, providers are out there, you know, letting other people know, hey, these are the signs. And if a mom says something, we are mom, we're seeing our children.
That's right.
We are seeing the things. We know what's normal, what's not normal. If we are saying those things, and now it's different. I was saying that to Dr. Karen. I said it's very different now, because you're seeing providers are more aware of different things. They learn much better. The other day I was with my son, and they were ready for him because they knew, hey, he has autism. There's certain things like he likes, there's certain things like he doesn't like. So now, but before it wasn't like that. Before it's like, oh, why are you not ready for my son? Why are you giving him a shot? Well, you know he's gonna be scared. So all these things take into effect. So
Well, Joy, I want you to jump in here, because I know we hear autism, and in folks' limited knowledge, they think of just boys. And oftentimes diagnoses in girls go, you know, undiagnosed and untreated.
Yeah, well, I think that a lot of studies focus on how autism presents in specifically white males, and then go off of that, how it presents in boys and girls. And so I think there has been more research around how it presents in Black and brown males, but not as much research with girls. And so there's a lot of outside contributing factors to why it's not being diagnosed, but I don't think the research is there just yet. And
Yeah. Jay, you're doing this research. What are you seeing in terms of gender difference?
Yeah, we're really trying to actively recruit more female participants. And what Joy said is exactly right, that the archetype for studying autism is the white male. And girls present very differently often. It could be because of socialization. It could be because of masking these kind of dynamics, but all we know is that we need to study them further. It is extremely unacceptable that so many women are diagnosed into their 30s. And you can imagine how many misunderstandings, how many pieces of discrimination they've experienced up until that point. There's usually accumulated grief within those families because they weren't aware that the kid had neurodevelopmental differences, and were attributing some of their differences to personal choices, these kind of things, which it's really sad. They needed services much earlier. So it's abysmal, really. It's really actually an area that needs specific attention and urgent attention.
Well, speaking about that, Dr. Spencer, what's the call to action here as we have this conversation, which I think is long overdue when we're talking about ASD?
I think the call of action is pretty clear about how we need to really expand how we look at, what is causing the gap between, when people, children, non-BIPOC children compared to BIPOC children are being diagnosed. I think that so much of disparities research over the years has focused specifically on providing resources or what kind of education that can be provided and things like that, where it's much broad. I think the issue is much broader than that. It's what kind of things can we do from providers in our behavior to make sure that these children and families are getting the care they need. What kind of systems can we develop? What kind of systems do we need to have? What kind of specific outreach do we need to do? I think it's a much more complex question than we've been treated historically in the medical research. And so I think this kind of points to our need to kind of broaden our efforts in terms of what we can do to help narrow the gap.
Well, Joy, you're in the community at the Dimock Center. What would be your call to action for folks?
Yeah, well, I think one of the great positives of being at the Dimock Center is that we have so much collaboration within the health center. As an early intervention specialist, I'm able to go to the early childhood programs and speak with the teachers and support the teachers and let them know what we're seeing and what signs they should look out for. We also have access to all the pediatricians at Dimock as well, and we're able to create great collaboration and partnership with all of these systems that will not only be prepared for the kids coming in, but then also being able to support and provide those resources and empower families as well.
For sure. Jay, you're nodding there.
Yeah, the Dimock Center is awesome. I think something also to pay attention to is intersections. So we see a lot with ADHD diagnoses that white children are receiving many more of them, and Black children instead are getting conduct disorder, oppositional defiance. So we see some of the patterns replicating themselves with children with ASD, that when teachers and clinicians sometimes see Black children struggling to communicate something that they need or something, and then see some behavioral issues, they don't think of, there might be neurological differences. They're like, there's a behavioral issue, your son is becoming aggressive. Like, a lot of the stereotyping that we see between the police in our communities is also happening in the classroom, is also happening in our medical centers. And we're just trying to approach children now, that's the message. approach children if there's something going wrong with them behaviorally. Maybe they're trying to express something that they can't yet express.
Yeah,
Maybe they need more help.
Yeah, for sure.
Yeah.
All right, Cynthia, in our last minute or so, as a mom and as someone who works with other parents, what would be your call to action?
My call of action is get the children diagnosed.
Yeah, that's right.
That's the first step. I know it's difficult, and depending on the background, we just got to get that out of the way and get the diagnosis. And it's just us working together as a community. We need more awareness. We need people to talk more about autism, because the more we talk about it, the more the community will be aware of it, and the more better our children will be, because they'll get the resources and the help that they need.
That's right. Well, I want to thank you all for your time today. Just an amazing, robust conversation. That's the end of our broadcast and the end of our show. Thank you so much for joining us. I'm Crystal Haynes. You all have a good night.